This is Ed and Pat Sanders saying hello and welcome to African American Health Matters.
Critical numbers of African Americans are dying from prostate, breast, lung, and colon cancer because it's been treated too late. Even more African Americans are affected by diabetes, Alzheimer's disease, hypertension, asthma, high cholesterol, obesity, drugs, and alcohol.
And we are still needing continuing education and more about HIV/AIDS. Our surveys show we need more ways to access resources available in our community and nationally.
There's a staggering number of African Americans who are not aware of drug discoveries that could save their lives through clinical trials. And Ed, we need to educate our people about the importance of clinical trials. African American Health Matters is a mobile health, text message, and multimedia outreach that provides health tips and reminders to subscribers right over their cell phones. And now we have African American Health Matters on Cyberstation USA.
It's health tips for remembering to take your medication and tips on handling everything from diabetes, hypertension, and to tips on losing weight and breaking those bad habits.
You can register online to receive health text messages by going to www.africanamericanhealthmatters.com. That's all one word, www.africanamericanhealthmatters.com. Or you can call our 1-800 number, 1-800-677-8441, and someone will get back with you within 24 hours to get you registered.
Here's a tip from the National Headache Foundation. Small changes to your daily lifestyle can make a big difference. Diaphragm breathing can aid natural migraine relief.
Headache tips are always really good. The National Headache Foundation says that headaches lasting over 24 hours can be symptomatic of a larger condition and should be addressed with a doctor. If you want more information on that, go to www.headaches.org.
Diabetes health. Regular visits to your eye care professional is a must to prevent problems that can lead to blindness. Hypertension health. A great way to lower your blood pressure and combat the corrosive effects of plaque buildup is to exercise.
The Patient Advocate Foundation CEO and President, Nancy Davenport Ennis, personally became involved in legislative reform when a close friend, Cheryl, was not only battling cancer, but also her insurance company, which refused to cover her clinical trial treatments. While her friend Cheryl bravely fought for her life, Nancy, with help from the Virginia Task Force for Insurance Reform, worked on reforming coverage for cancer patients. In 1994, the task force was victorious with the passage of Virginia House Bill 240. But Nancy didn't stop there. She founded the Patient Advocate Foundation. All of these cases involve patients with chronic, life-threatening, or debilitating conditions. Some need help taking on their insurance company. Others have no insurance, while others have coverage but need financial assistance to buy medicine. None of these clients will ever have to pay for the help they receive from the Patient Advocate Foundation. And the foundation is able to successfully resolve more than 98% of the cases it takes on.
Well, when patients call PAF, oftentimes they have a myriad of issues that they're faced with. What they can expect from us is comprehensive, individualized services designed to help with their immediate need and also identify future needs that they may have as they move through illness back into good health. Our case managers are highly trained, they have diverse backgrounds, and when a patient calls our 1-800 number, they're immediately connected to a live case manager. The case manager does an initial assessment of their needs. We fill in an intake form where we capture all data necessary to work their case, and then that case is assigned out to a case manager based on area of specialty that will work with that patient from initial intake through full resolution.
When people call us, they're desperate. Every avenue available to them to solve the problem has not worked. and it's their life that they're fighting for. And at the end of the day, you're going to battle to save your life medically, but we don't want you to have to battle to save your life financially and to feel that you're losing all of your integrity and your hope because you can't get the financial issues solved or an insurance issue solved. We can do that for you.
It's very important that the people in this country realize this organization exists and that they know how to get to them, how to contact them, and get the help they need.
For more information, please visit us at www.patientadvocate.org or call us at 1-800-532-5274.
Robert Sanders is a prostate cancer survivor. He served 4 years in the Air Force. He received his BA from Wayne State University and MBA from Cleveland State University. He worked for City National Bank as a systems designer, and also he worked for Chrysler Corporation as a computer programmer and a computer systems manager. He is now retired from Chrysler Corporation as a regional depot manager. We're here today with my brother, Robert Sanders, who's a retired regional depot manager for Chrysler Corporation. Hello and welcome to the show.
All right. How are you today?
Very good.
Be here with you.
Very good, very good. You know, when we were coming up as a child, we actually knew nothing about prostate cancer. It never came up. So we don't know if our fathers or uncles maybe have had it. We had no idea. So we actually were the first in our families, males, to actually get involved with prostate cancer. So just tell us, what was your first real involvement with prostate cancer?
Well, like you said, we hadn't been involved in it and didn't know much about it because most of our family had, all our older men had died from heart attacks. So it's about 47 years old. When I got to 48, I celebrated. I thought I'd live forever. But then again, my first real encounter was, and I was typical, like you said, I didn't know much about it, didn't read about it. My first real encounter was when you encountered prostate cancer, which is, I was in my mid-50s, and I didn't know anything about it, and you seemed to have had no problems with it, and you came through it okay.
Okay.
Seemed to survive, and I didn't know of any serious things wrong, so I didn't think much about it then, to be very honest.
Okay.
And that was in my mid-50s. I got a little more interested in it. As you say, I was with the Chrysler Corporation, so we had to take an executive physical every year. And I got really, when I was in my mid-50s, my first thought, when I first found out was that he told me my PSA was up.
Okay.
I didn't know what that was. You know, what is my PSA? PSA, well, it was a measure of how your cancer deals with your prostate. So and he told me it shouldn't be over 4, and then it was up around 5 or 6. Well, we didn't get too excited about it then. So our next few physicals, it started going up again, and when it got to 6, 8, 12, and then finally got to 13, then I started to get a little worried about it.
Okay. Well, you know, it's amazing how I found out. I was actually calling my doctor to confirm an appointment the following week, and no one was in the office, so his nurse called me back and left a message, and she said, you need to come in on Monday so the doctor can tell you about your cancer. And that's how I found out about found out that I actually had prostate cancer. Heck of a way to find out about it. So what did you do after you first found out about it?
Well, when I first found out about it, like I said, I didn't pay much attention to it until it got up to around 13, which, as you know, is very high. And I said, I better go get a second opinion of this thing. So I went and got a second opinion. They gave me a biopsy. He said it looked bad. I needed to get surgery right away and did this and did that. But for some reason, I didn't feel real comfortable with this particular doctor.
Okay.
So I went a little while longer, and I got another second opinion, and he did tell me it was up.
Okay.
But for some reason, I liked this guy, so I got another biopsy again, and he told me, you need to have the surgery.
Okay.
So that's when it really got my attention.
Okay. Well, you know, a long time ago when you and I got our prostates taken care of, they had maybe a couple of treatment options, but nowadays they have probably 5 or 6 or more.
Right.
So what type of option did you analyze, and actually what made you settle on that one option?
Well, as you said, back then, they only told us about two things, really.
Mm-hmm.
It was the surgery, which was the one option, and the radiation, which was the second option.
Okay.
And at that time, I was in Atlanta, and they had a new option, which I didn't get too interested in because it was only a year or two old, and that was the seed.
Okay.
But they freeze it. So I didn't get too excited about that. But what I did, I talked about the surgery, and it sounded the most promising. It was a little more than radiation because, as you found out, the radiation can miss.
Mm-hmm.
So I chose the surgery. And my urologist at that time, Dr. Haas in Atlanta, happened to be a surgeon. And he looked at it and he told me, he says, well, you know, your prostate is not enlarged, which was a good thing,
Mm-hmm.
which meant I didn't have to have that radical surgery, which was where they just cut your stomach open and go down through all this good stuff
Mm-hmm.
and look at it and take it out. And at that time, he gave me a tape to look at, and I actually viewed a complete surgical operation on the prostate gland,
Mm-hmm.
and it was very interesting. Like he said, since mine was not enlarged,
Mm-hmm.
he could take it instead of doing it the normal way, taking out the stomach, I could take it out the other end. So I said, fine. Then I didn't have to have that big scar, all the cutting, and so forth, and I could recover a lot quicker. So that's why I decided on, let's do the surgery, but I'll take it out, the other way.
Mm-hmm.
I said, by the way, Doc, which he knew me, we got to know each other by then pretty good. I said, by the way, I looked at the tape quite a while myself, and I said, I think I could do the surgery, but I wouldn't know how to put myself back together. And we laughed a little bit.
Mm-hmm.
And I told him, by the way, before you go into the surgery room, make sure you don't use any GM parts. So we laughed about it, which was pretty good. So
Okay.
that's how I finally settled on the surgery.
Okay. Well, we had, when I found out, it was back in 1995, and we were scheduled to go to South Africa to do a program for Nelson Mandela.
Right.
And the doctor told me, he assured me, take the trip and then come back, and then we'll do the surgery. In the meantime, he encouraged us to form our new company called 50 Hoops, which is a prostate cancer educational basketball tournament and health fair. And from that, I've also encouraged a lot of my friends, my barber, you, my brother, my brother-in-law. I always tell a man to go get screened because you never know when it's going to metastasize or spread. So it's very important to make sure you get that screening. And the doctor always told me that once you get the surgery, there's a possibility that some of the cancer, they may not get all the surgery, all the cancer out, so you may have to come back or you may have an occurrence or reoccurrence. You had a reoccurrence, so tell us a little bit about that.
Yeah, it's good you mentioned that. When he had my surgery, he said it took him about another 45 minutes to an hour because when he went in there, one of the reasons why my PSA was so high was because it had sort of slid into the bladder canal, he called it. So it was a little bit over into the bladder. So when he finished the surgery, got it out, he did another biopsy, and he found there was a little bit more cancer in there. So he had to go back in and do some more.
Mm-hmm.
And he told me he was a little bit concerned about that, and he said because of that, it looks like he had it all out. But he wanted to watch my PSA pretty close. And that happened to be back in 1997.
Okay.
Which worked out pretty good. But a couple of years later, lo and behold, my PSA had started to rise because I was going for that, my regular PSA test.
Mm-hmm.
You got to go in right away. So right then, he told me I best go in for the radiation. So at that time, I went back, and I had to go for 7 weeks of treatment, 5 days a week. So after 35 treatments of radiation.
Mm-hmm.
And luckily, it's been clean ever since, and that's been over 13 years ago. My PSA has been down around 0, which I think is great.
That's great. That's always good to hear. And You know, you are a retired executive from Chrysler Corporation. When you had your prostate cancer, when you were going through that back in 1997, I know you did a lot of things to promote prostate cancer back then. Tell us about some of the things you actually did to promote it back in 1997.
Yeah, thanks to you guys at 50 Hoops, I got very interested in it. And one of the things that I did is I had developed some presentations because I'd been in the corporate world. I had done that from time to time. And at that time, I was running a plant in Atlanta. And I put together a presentation on prostate cancer from beginning to end, slides and the whole ball of wax. In fact, to keep the women from getting mad, I even talked a little bit about breast cancer.
Okay.
They wouldn't get too upset about me forgetting about them.
Okay.
But it went over pretty good, and I used that presentation several times. And in fact, over the next few years, several of the people out in the plant had been like myself and yourself. They hadn't paid attention to it. They got PSAs and found out for sure that they had it.
Okay.
In fact, one of the guys had waited too long. He just couldn't help himself.
Okay.
And some of the other things I had done, you mentioned 50 Hoops, which was you guys' event. I remember I attended a couple of those with you guys. I had the one I had in Atlanta. Worked out pretty good. And you had one in Detroit, which I came to and brought a lot of our daughters to that one.
We also did a radio show in Atlanta, too, I remember.
Yep. We did. My urologist was a pretty good guy. He and I got to be pretty good friends because he did have a Mercedes-Benz, which at that time was a Chrysler product. and he and I and yourself went on a local television station in Atlanta, and we did a prostate awareness half-an-hour show, one of those weekly information shows, which worked out real good. And so over the years, I've done the presentation several times. I haven't done it for quite a while, but the thing worked out pretty good. One other thing that comes to mind that we also did, in fact, you guys did it, I attended it, is you guys in your physician referral group did a cancer seminar in Detroit at that time.
Right, that was actually a dinner lecture series in Detroit. That's right.
Right. You had fine doctors there from Ann Arbor and several University of Michigan and several other places. And I was one of the ones that I spoke at that one to help spread and the awareness to the public. So it's worked out pretty good. I've been pretty active with it because everybody I talked to, especially all the young men in the family, because we've had a couple of my brother-in-laws that had passed, and I made sure that their sons were aware of the fact that the closer the person is to you and the family, the higher your risk is of getting the prostate cancer.
That's right. That's right. That's right.
It worked out pretty good. So I've been a pretty good ambassador. You guys have done a lot of work, which I'm real proud of. I keep aware of that on the 50 Hoops internet site. And you guys have done quite a bit with that thing.
Yeah, we actually have done this for the last 14 years around the country in different cities, because each city we go to, I always find that several men in their 50s, 40s, etc., maybe in the 60s, have never had a PSA. They don't know anything about it. And they're actually afraid because they don't, when you start talking to these men, they don't know if they have prostate cancer or not. So when you mention it to them, they automatically tense up and tighten up because they're afraid. The fear factor is there. So I always try to encourage men wherever we go to go get tested, go get checked, because it's very, very important, and it's something you cannot ignore, because if you live long enough, especially an African-American man, you're either going to get an enlarged prostate or prostate cancer, one or the other. So it's very important to get tested and get checked out on a regular basis.
Yeah, and one of the things that I emphasized about that, especially in those lectures that I did, the presentation about getting the digital rectal exams, because you mentioned the enlarged prostate, and what I found in most of the audiences, there are always several men that they had a real problem with that DRE, we call it, with the rectal exam. Guys, they would come up with, I wouldn't do that, I wouldn't do that. I said,
That's right. That's right.
Education and take that down.
That's right.
And I used to get a big laugh out of their groups, and I'd tell them, I said, the biggest advice I had for that is if you would go to get the exam, find you a female doctor with small hands.
That's one way to look at it. You're
One
certainly
way to
right.
look at it. I say it's a lot better to live than to worry about the fact that you didn't want to go through this and that. But I think it worked out pretty good. I've been free pretty much. My PSA has been zero now for the last 13 years, and I hope it stays that way.
Okay.
And the only thing I've had lately has been, in the last couple of years, has been an overactive bladder.
Okay.
Makes me urinate
Mm-hmm.
a lot more often. But as I said before, that beats the alternative.
Mm-hmm.
And I think that was from that cancer that slipped over into the bladder area at that time. But other than that, I feel pretty good about mine.
Okay.
You guys, and I'm proud of what you guys do. You guys have done a fantastic job.
Thank you.
I just wish I could have traveled with you, but I travel too much when I work, and I don't want to travel anymore.
I understand that. So basically today, you're not having any problems at all, and you're doing fine.
I'm doing fine. The only thing I have that I could probably, and I can't say I could attribute it directly, is the overactive bladder.
Okay.
But if that's all I have no problem.
Okay. And do you still get your a PSA test done on an annual basis?
Still get one on an annual basis. In fact, I was due for one not long ago, and it was still at zero. And the only thing I tell my wife, and when I come back from it, I said, well, you got to put up with me for another year. PSA was still at zero.
Well, and that's not all bad.
That's not all bad. But I feel real good about the thing. And as you said, I just like to talk to every man about it because most men don't know about it, and they were just like I was, and you were. Just didn't know about it. Nobody ever told them.
That's right. That's right. And I'm proud to say I'm proud of you being a 14-year survivor and myself being a 17-year survivor. And that's only because of early detection. We went down and got screened at an early basis, and they caught the prostate cancer before they had a chance to spread. So I want to encourage all men to, as I say, get up off your butt, put the macho thing aside, and get screened at least once a year because it may save your life down the road.
And I honestly believe it saved mine because, as I say, mine had gotten up to 13, and it had already leaked into the bladder area then. I don't know this. If I had waited 6 more months, it may have been too late for all I know.
That's right.
So everything you say is true. Get the exam. You can't hurt yourself getting it. It doesn't cost that much, even if you didn't have insurance.
That's
All
right.
it is a simple blood test.
That's right.
And unless they find out it's enlarged, and they just go in and see if it's enlarged, and I say you're better off if it is enlarged.
That's right.
Whether you realize it or not.
That's right.
Take that exam and take some medication because the surgery is not always fun, but it does work.
That's right. That's right. And once again, we can't emphasize enough how important it is to get screened. Early detection, it could save your life. But in closing, do you have any other remarks, any other encouraging remarks to say to our listening audience at this time?
Well, the biggest other thing is remember, it is hereditary. It's in our family. And if it's in your family, just remember the person that has it, and it doesn't have to be prostate cancer. One of the things you got to remember is cancer is cancer. It's just a matter of where it hits you at.
That's right.
If it hits you in your prostate or your breast cancer for women, because they can get it out. So if you got a person in your family that's very close to you, say a parent or a sibling, you want to really get it checked out because there's a good chance you have it because it does spread and it is hereditary. You just don't want to let it spread. As you said, you need to get the exams, and that's all I can tell people. I think I was lucky. I think if I'd waited another few months, that might have been history by now.
That's right. And that's something we really don't want to think about or dwell on.
If I can live with the overactive bladder.
Now, again, we've been talking to my brother, Robert Sanders, retired Regional Depot Manager from Chrysler Corporation. We thank you again for being on our show, African American Health Matters, on Cyberstation USA.
Thank you for having me. You and Pat, you're doing a wonderful job. Keep it up. Love you both.
Very good. Thank you again.
Thank you.
Did you know that African Americans have one of the highest rates of asthma? Asthma is a lung disease that makes breathing difficult for both young and old. Although there's no cure for asthma, it can be managed and treated so you or your loved ones can live a normal, healthy life. You can be as active as you want to be. The American Lung Association can help. Learn more about asthma and keep it under control by visiting www.lungusa.org or call us at 1-800-LUNG-USA.
Normal blood pressure is important for proper blood flow to the body's organs and tissues. Each heartbeat forces blood to the rest of the body. Blood pressure moves from high pressure near the heart to low pressure away from the heart. The force of the blood on the walls of the arteries is called blood pressure. Blood pressure depends on many factors, including the amount of blood pumped by the heart. The diameter of the arteries through which blood is pumped is also an important factor. Generally, blood pressure is higher when more blood is pumped by the heart, and the diameter of an artery is narrow. Blood pressure is measured both as the heart contracts, which is called systole, and as it relaxes, which is called diastole. Systolic blood pressure is measured when the heart ventricles contract. Diastolic blood pressure is measured when the heart ventricles relax. A systolic blood pressure of 115 millimeters of mercury is considered in the range of normal blood pressures, as is a diastolic pressure of 70. In common terms, this normal measurement would be stated as 115/70. Stressful situations can result in a temporary increase in blood pressure. If an individual were to have a consistent blood pressure reading of 140/90, he would be evaluated for having high blood pressure. If left untreated, high blood pressure can damage important organs, such as the brain and kidneys, as well as lead to a stroke.
Be sure to tune in on Fridays from noon to 1 to African American Health Matters on Cyberstation USA.